It's Russ Curtis, Professor of Counseling. Thanks for joining me today. I want to talk about another category or domain of obsessive thoughts within obsessive compulsive disorder. And it's called scrupulosity or religious obsessions. Okay, so these are some common ones. And let's keep in mind before I go is just that OCD is very treatable, oftentimes with therapy and a combination of perhaps SSRI medication. Again, all of that's under your doctor's guidance. But this is very treatable, but unfortunately, a lot of people go a long time before being treated. They see themselves as flawed, and that's what this graph represents on the right. I'll talk about that at the end. All right. Common ones, unacceptable thoughts about religious figures. This could be intrusive images about having sex with religious figures. And again, the obsessive piece is the thing we want to keep in mind here. Passing thoughts, that's common. We all have thoughts are just thoughts. We all have, different types of thoughts, but this would be obsessive. Thoughts of being possessed, obsessive thoughts of having to be perfectly religious. So the obsession that you're not praying correctly would be a common one there. Fears of having acted sinfully, even though there's kind of no record for that, and I guess we have to define sinful, but there's this fear that that's happened, that you've already done that. Fear of being deliberately sinful is that you have this obsession that I am going to act in a way that would offend my values or offend your religion's values. And doubting your faith or religion. Again, obsessive thoughts about that, because passive thoughts, and we probably should spend a lot of time thinking about, all right, what about this makes sense for us? What exactly is our place in the world and where we fit and so forth? All right, so I hope this is helpful. Let me know your thoughts. And I did want to say on the concentric circles here we have, it's important for folks to recognize that even though OCD is problematic, it is treatable, and there's more to you than that. And I just wanted to point out that you've got your education, your career, your relationships, your interests, your goals, your culture, and how you celebrate that and how it informs you. So there's so much more to you than just OCD, but we recognize that OCD can be very problematic, but just keep in mind it's treatable. All right, good people. We will talk to you on the next video. Take good care.